Imagine your heart working overtime every single day, quietly straining against the pressure without a single complaint. This silent struggle is what millions experience without even knowing it, putting their health at serious risk. Title: High blood pressure, the silent killer you can't ignore.
Listen to the following talk.
High blood pressure, also known as hypertension, is a medical condition where the force of the blood against the walls of the arteries is consistently too high. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed with two numbers. 1. Systolic pressure, the top number, which measures the pressure in your arteries when your heart beats. 2. Diastolic pressure, the bottom number, which measures the pressure in your arteries when your heart rests between beats. Categories of blood pressure in adults: normal, systolic less than 120 mmHg, and diastolic less than 80 mmHg. Elevated, systolic 120 to 129 mmHg, and diastolic less than 80 mmHg. Hypertension stage 1, systolic 130 to 139 mmHg, or diastolic 80 to 89 mmHg. Hypertension stage 2, systolic 140 mmHg or higher, or diastolic 90 mmHg or higher. Hypertensive crisis, systolic over 180 mmHg and or diastolic over 120 mmHg, which requires immediate medical attention. Causes and risk factors: genetic factors, family history of high blood pressure, lifestyle factors, poor diet, especially high in salt, lack of physical activity, being overweight or obese, excessive alcohol consumption, and smoking. Other conditions, such as kidney disease, diabetes, and sleep apnea. Symptoms: often referred to as a silent killer, high blood pressure typically has no noticeable symptoms. Some people with high blood pressure might experience headaches, shortness of breath, or nosebleeds, but these symptoms are not specific and usually occur once blood pressure has reached a dangerously high level. Complications: if left untreated, high blood pressure can lead to serious health issues such as heart disease, stroke, kidney damage, and vision loss. Management and treatment: lifestyle changes, eating a healthier diet with less salt, exercising regularly, maintaining a healthy weight, limiting alcohol, and quitting smoking. Medications: various types of blood pressure medications such as diuretics, ACE inhibitors, beta blockers, and calcium channel blockers may be prescribed to help control blood pressure. Regular monitoring: regularly checking blood pressure to ensure it is within a healthy range. Managing high blood pressure involves a combination of lifestyle changes and, in some cases, medication to reduce the risk of complications and maintain overall health. This is merely a sample of material for learning English. Thank you for watching. Summary: high blood pressure, or hypertension, is a common but often unnoticed condition where the force of blood against artery walls is consistently too high. It's a leading risk factor for serious health problems like heart disease and stroke. Despite often having no symptoms, it can be effectively managed through lifestyle changes and medication. Understanding the causes, recognizing the risk factors, and regularly monitoring blood pressure are crucial steps in preventing the dangerous complications of this silent killer.
Thank you for watching. This is a VTP channel. You can find us at youtube.com/VTP.